Hi, this is Jim LaValle, clinical pharmacist and board certified clinical nutritionist for Da Vinci Laboratories education series. What we're going to talk about in the next hour or so is about a nutritional perspective to exercise prescription. I think it's important that you realize that a lot of people get out there and try to train, but if they don't have a great nutritional foundation, it's going to limit their ability to really achieve and get the goals they want. And I don't care whether you're a professional athlete, like I work with a lot of NFL players, NBA, NHL players, or you're just an enthusiast wanting to have the best health you can in order to train your hardest and get the most out of the results. You really need to have adequate nutrition status so that you reduce your risk of overtraining, of causing non-contact injuries, and just to maximize the results that you're going to get. Because it really is, exercise is all about risk versus benefit. I mean, there's clearly that the harder you train and the more you train, the more you put your body in a super-physiologic event, and that's going to mean you need to create more countermeasures to kind of get you back to a neutral state. For example, a lot of people are now talking about don't take any antioxidants after you train. That's great as long as you're not overtrained and already in an excessive oxidative state when you begin your workouts each day. So it is really about understanding risk versus benefit and how do I keep my body in its best possible stance to benefit from exercise. It's a new focus. Most athletic nutrition focuses on during and after training. Hey, drink this pre-workout, drink this post-workout. It really discounts the other 20 hours of the day that's really needed to optimize performance for people. And once again, this is whether you're the novel exerciser, you're an enthusiast, or you're a professional athlete, that other 20 hours a day is really going to dictate what's going on with your nutrition, your hormone balance, sleep, stress. All of those things come barreling down on your chemistry and can affect how you're going to perform. When you exercise intensely, it creates more cortisol, a more dramatic cortisol response, more dysglycemia, a bigger deficit in amino acids, a bigger risk to get a deficit in minerals and trace minerals. It creates immune shifts and creates immune stress. All of you have heard of people that are getting ready to go into competition, going to the Olympics and, turning up sick or getting a cold and flu. It's estimated that 10% of people training that or, for events like that, like the Olympics, will end up not being able to compete because of some kind of immunologic stress that occurred. It can create more catabolic metabolism in your muscle tissue. You can become more prone to injury, and you can decrease your metabolic efficiency because you end up creating too many inflammatory cytokines when you exercise intensely and do not take into account appropriate countermeasures nutritionally. Now, when it's moderate exercise, it's kind of interesting, and a lot of people don't find moderate exercise as exciting, and I know I'm one of those exercise junkies that I like to train hard, and as I've aged, it's been more apparent that, well, maybe I need to incorporate moderate exercise in with some of my more intense exercise, because moderate exercise improves your mood. It's been shown to improve HPA axis signaling. It improves blood sugar metabolism, oxygenation of tissues, triggers fat burning by improved insulin regulation, better enzymatic activity in muscle, increases the bone density and muscle to fat ratio, along with basal metabolic rate, reduces fluid retention, and reduces stress hormones. So the point is that even though moderate exercise, which would be under a 60% rate of your max heart rate, and for an hour at a time or less, while it might show itself to be more inviting metabolically, the issue becomes, well, if I want to get more results, or I'm training because I want to do a Tough Mudder, or I want to do a biathlon or a triathlon or a half marathon, you're going to train harder. And once you start training harder, your body demands go up. The goal of all exercise is to create a load that is effective at improving performance. Training creates muscular overload. It disrupts homeostasis. It can create soreness and fatigue, but it results in improved performance, right? You hope. And simple accomplished? I don't think it's so easy. A lot of people do well for a year or two, then all of a sudden they see their abilities erode, and a lot of that has to do with the fact that as you're creating these increased demands on your body, from your nervous system to the communication with your immune system and your muscle tissue, that signaling and relationship starts to break down. A lot of injuries. I mean, 50% of injuries are in non-contact sports are thought to be avoided by not having as big of imbalances in nutrition. So electrolyte balance being a big one, maybe not enough protein. And so some of these injuries could definitely be reduced by proper nutrition. Dehydration is such an important piece. Hydration is essential. Looking at getting good quality water, maybe hydrogen water, kind of a new hot topic, which I think is interesting. And then just nutrient deficiencies. A lot of people are on medications that are depleting nutrients that are affecting their performance, and they're not replacing them. So if you're on a statin and you're depleting CoQ10 and vitamin D, and you can wonder why over time your muscles aren't generating as much power, you're feeling some lethargy in the gym, then you start to even ache. It's because of that loss of those essential nutrients. Same thing for women on oral contraceptives. It can do the same thing. So obviously being overweight can cause big problems with injuries too in the common population. So immunologically, it's important to understand that physical stress on your body will require an efficient immunologic defense and balancing. You have to have adequate fatty acids and vitamins and minerals and nutrients and amino acids to support immunologic drive. Intense exercise alters your immune system. And if you train enough, you can become more prone to upper respiratory tract infections. Very common in athletes that overtrain. You can be commonly stressed out and training hard. That can alter immunity. So if you're training for a competition, or maybe you're an athlete, you're training for a big game or a big season, that anticipation has to be balanced with the right nutrients so that you're able to actually perform at your best when you're in the heat of the moment. So the chemistry of heavy exercises, I've always made kind of this comment that I've seen observationally, because I mean, I've looked at quite a few athletes at this point, is that their metabolic changes don't look too different from people that are ill. They start to get insulin resistant, they start to feel sluggish, they get a little bit of that loss of focus, kind of thick-headed feeling. They're not as resilient, they don't recover as quick. It's not that uncommon from the ill population. The difference is they're still functional and they're still able to perform, but their chemistry is starting to erode their ability to perform at their best. And of course, it's really important that people stay in an anabolic state when they're training. So not managing cortisol or not having enough DHEA on board or not being efficient with insulin receptor function so that you can carry amino acids onto the muscle to be able to rebuild post-training, it limits your success when you don't take into account the ability to maybe use nutrients to help with glucose balance, to help with stress hormone balance, so that you're able to stay in that sweet spot of performing optimally and not having intense physical activity erode your capacity. So, I like to call what we do a systems biology approach, meaning that we take into account that your body's operating in networks like adrenal, thyroid, pancreas, for example, or gut, immune, brain. In reality, when we make these networks up, we still have a whole body metabolism effect, right? all of your body is interacting and sending out signals and cross-talking with other systems in your body. And so the signaling and crosstalk that goes on between tissues and organs, it's really what's driving your future health towards a distinct endpoint of either being healthier or not. And a lot of athletes turn a corner and break down and they go, how did I get here? What happened? Well, it happened because your metabolism kind of works in a snowball effect, right? The more things start to go wrong, the more things go wrong, the more inflammation that gets sent out, the more stress response that occurs. It's important to think of how you're going to reorder this whole body metabolism signaling to move a person towards being healthier and feeling better. Because if you don't get them feeling better, I think that's the key thing you need to reach for, because otherwise, why are they coming back to you? They won't find the value if they can't tell hey, I recovered better from exercise, I ran more efficiently, I'm just feeling better and motivated to exercise, my mood is good, I'm not getting colds and flu. Those are the things that make a difference to people. And you know what? If you don't think it's going to be a very big business, you look at this. People in their 40s are the fastest growing segment in the sport of triathlon. So there's a lot of people doing triathlons, marathons, half marathons, Tough Mudders, Spartan races, you name it. And there are people flocking towards testing their mental will on exercise. And the one thing that I try to encourage people to understand is if you haven't exercised in a long time, get your nutrition status right. It will go a long way to protecting you from a big event. This is an interesting study in 2010 that was just on 14 men and 6 women ages 21 to 55. They're racing, after their race, it temporarily increased the risk of death by 7-fold. When they mean that, it's like their blood chemistry. This was another interesting study back in 2011 in the European Journal of Heart that showed 40 athletes being followed, and most would reverse their damage to the right ventricle with 1 week of the event that they participated in, but 13% begin to develop fibrosis. So one of the markers you can look for in tracking this, of course, is galectin-3, which is a common compound that you can get tested for. When the damage is higher in the heart and the training is causing this fibrosis, that galectin-3 will go up. It's kind of interesting. They actually correlated galectin to outcome on cancer too. The higher the galectin, the lower a worsened cancer treatment outcome. I heard that actually at Children's Hospital in Orange County. They were talking to the oncologist there. So pretty interesting that it spans that marker spans metabolic damage from people who are training into people who are fully de-differentiated in that cancer world. So ibuprofen use in marathon competitions and ultramarathon competitions, what they find out is that it not only does it not reduce muscle damage, but it increases more circulating endotoxin and creates more inflammation versus controls, elevated C-reactive protein, more inflammatory cytokines like interleukin 6, 10, 18, IL-1RA, MCP1. So all of these markers go up, and it was also associated with worsened kidney function post-race. So the more you can take care of your body going into the race, the less the risk going on after. Ibuprofen certainly not being the ideal choice to manage inflammation, and in fact seems like it can accelerate some damage according to this particular study. And so, what are we protecting against? We're protecting against this, overtraining. Major reason for underperformance in athletes. It could be also an underlying medical condition. There's no really good labs for it directly. The recovery can be lengthy, anywhere from 2 weeks to 12 months. What are the signs of overtraining? Fatigue, mood changes like depression, feeling burned out. I don't want to go to practice. I'm not enthusiastic about the game I'm playing anymore. Or if you're an amateur athlete and you're just training on the weekends, but you're also training hard during the week, you can start to lose your motivation there and even notice yourself and change moods in your workday. You can be anxious or depressed, your sleep pattern changes, your focusing ability goes down, you get more soreness than you probably should. Your sex drive lowers, you get increased upper respiratory infections. These are all signs that you have been training too hard. And there's more and more people I see in this situation. I have retired executives. I had a retired executive woman that went to Orange Theory twice a day and was training and couldn't figure out why she was getting anxious, why she was having sleep problems, why she was being, her sex drive was off. All these different things that popped up that were just simply not because she went to Orange Theory. Orange Theory's fine, but she was doing it twice a day. And then she was going other places and working out as well. So she was pushing herself past her limits. And, as we think, there should be some real thought of how do we begin to create some key, relationships, looking at the mitochondria, looking at gut immune brain, understanding the relationships between the thyroid gland, the adrenals, and the pancreas. So that whole thing of how I produce energy, cortisol, thyroid hormone, glucose levels, and insulin regulation. And then, look at what lab values and relationships that really count. And then what supplementation can work. So the first thing to note is that, when we're training, you're supposed to be stressed out in the day and you're supposed to repair at night. Got a lot of people that work out at night. So the more that we have people that work out in the evening, the more they got to take countermeasures to help them get to sleep. Because they really, if they're working out at 8 o'clock at night and they're getting home at 9:30, they are really close to where their body's supposed to repair. So getting the right nutrients are incredibly important. And remember, your stress hormones go in a diurnal pattern. More stress hormones in the day, less in the evening. Better, if at all possible, to train during the day. But if you need to create a pattern of training in the evening, by all means, you can do it, but you just have to attack the nutrient imbalances that may occur, or getting that nervous system to shut down to a more calm state into the evening. Anabolic versus catabolic hormones. I mean, cortisol is the big one. It's the king. I mean, you need cortisol. Cortisol is good for us, but if you take too much, or you take in too much by manufacturing it in your body, or you don't make enough, at either end of that coin, it's trouble, right? So when cortisol goes high, endurance athletes tend to have it go high. It causes things like insulin and glucose disruption. It's catabolic. It spares sodium and wastes magnesium and calcium and potassium. You get altered immunity. You're less prone to be able to fight off colds and flus. You tend to become more on the immune activated side of your chemistry, where allergies and those types of things start to affect you. Sex hormones go down. When cortisol goes up, you don't send the signal to make sex hormones. When cortisol goes up, thyroid hormone conversion of T4 to T3 goes down. When cortisol goes up, mood and cognition changes. When cortisol goes up, you alter sleep patterns. And when cortisol goes up, adrenaline and noradrenaline get affected. So epinephrine and norepinephrine also are affected in their output over time. This is an interesting little study that showed hair samples from 304 amateur endurance athletes, 190 female, 114 males versus controls. Hair cortisol was measured for a long-term cortisol effect. And let's look at the self-reported volume of exercise, and let's see what this showed. Well, the more you exercised, the higher your hair cortisol levels were. So if you look, cycling and 10K runs, although this looks good, it's still 35% higher than baseline. And then marathon looks maybe just a little higher. Triathlons go higher, and then full marathons go, are the highest in terms of stress and cortisol. So this is pretty important. And a lot of these athletes, I think this clicked by here, my bad. Cortisol and endurance athletes, you can see, if you take a look at this, it goes from at 5 kilometers up to 120, look at the changes in their cortisol. Cortisol goes up dramatically. This is what your diurnal pattern for cortisol should look like. It should be high in the morning, going down in the afternoon, down in the evening, and down at bed. And when it doesn't do this kind of pattern, we start to see problems with people's immune systems and their mental clarity, and a lot of their biochemical processes that go on. So this is how it should map out. This is particularly as a saliva test. I use a lot of urinary cortisols as well. So what are the things that you may notice if you're having issues with cortisol? You could have difficulty waking up in the morning. Your fatigue can decrease until lunch. Then you get a mid-afternoon low. You can increase your energy again after 6 p.m. Then you get tired again from 9 to 10 with a second burst of energy. If up at 11, and a lot of people complain of this, that they have hyperarousal of their cortisol at night, and that prevents them from getting a good night's sleep and getting to bed when they need to. So you just have to realize that, you know, the most refreshing sleep is going to occur from the hours of 10 p.m. and 6 a.m. You need 7 to 9 hours, and you know, morning sleep is super important as well. So when you're getting up at 4:30 to go to a boot camp, really realize that you're probably cutting short your brain's repair process for that following day. So I'm sure Dr. Heyman talked about allostatic load when he talked about the adrenals. And basically, you just have to realize that allostatic load is wear and tear on your body and your brain resulting from chronic overactivity. That can occur due to physical or mental or environmental challenges. Well, allostatic load is basically the load that is on your body that results in the HPA axis either overworking or can't shut off after a stressful event. So basically what happens is you overtrain and you don't have the right nutrients, is that you begin to alter the signaling of your HPA axis. And the other thing that's important, in fact, is you get more stressed out and your HPA axis starts to flatten and you start to lose your cortisol curve. It starts to affect circadian rhythm. And when we affect circadian rhythm, people tend to get sick. When they stop secreting cortisol in the morning and can't stop doing it at night, that becomes a problem. So you have this intensified immune vigilance that creates interleukin 6 elevations, and IL-6 is the big kind of cytokine that causes fatigue when you train. So just keep in mind, sleep, cortisol, melatonin, keeping your cycle during the day is incredibly important. And this is kind of interesting in athletic performance. So you looked at IL-6 and it goes up when people train really hard. If it's administered at rest, it can induce depression, inability to concentrate, and fatigue. And when it's given to athletes in the 10K run, they get a big impairment in their exercise performance. So managing interleukin 6, you need interleukin 6 to make your muscles repair. What you don't need is a bleed over of excessive interleukin 6 that doesn't ever let your muscles to repair. So it's produced within skeletal muscle during prolonged exercise. You get about a 2-hour plasma elevation. It regulates erythropoiesis. This is good. It regulates immunity. It helps with exercise-induced glucose regulating, and it stimulates the 5-hydroxytryptamine receptors. And IL-6 plays a role in the central fatigue hypothesis, which means when I train and I trigger all this interleukin 6, I end up affecting my brain's capacity for doing training, and I feel the fatigue centrally. So the fatigue is coming from the brain down. And then, of course, when IL-6 upregulates, it becomes a problem because it upregulates Claudin-2. When Claudin-2 gets upregulated, the tight junction permeability of the intestine starts to get compromised. And so this happens a lot with athletes where they'll get leaky gut. They'll start to react to foods and they start getting sore longer. and they really need to pay attention to the food that they're eating. So when IL-6 goes up, you make a lot of claudin 2. And if you look at this next page, when you make a lot of claudin 2, if you see over here, in this area where the arrow is, those are tight junctions. And when the tight junctions break, that means proteins are going to get into the bloodstream and start to lead to allergic responses. So normal digestion would be peptides, proteins to peptides, peptides to amino acids into the bloodstream and utilized for your health. What happens when your digestion gets more abnormal? It's protein, peptides, not sufficient enzymes. Proteins don't get broken down to individual amino acids. Now they hit the bloodstream and your immune system starts to react. So it's really important to understand that this whole aspect of nutritional credibility and overtraining syndrome, gut immune brain plays a really significant role, from the bloating and the gas and abdominal distension to the moods to interrupted sleep to brain fog. All of these things are interacting in this gut immune brain relationship. Thyroid, of course, is anabolic. It regulates proteins. It regulates fatty acid oxidation. It helps with insulin receptor expression. It's a really important hormone to keep intact. And interestingly, in athletes, they start to get hypothyroid and they start to have cardiac events due to their low thyroid state. And, this is in particular people that train harder and train longer, they don't look to repair their thyroid. So things like seaweed and ashwagandha and tyrosine can all play valuable roles. So cortisol causes thyroid hormone to be inhibited, right? So cortisol causes thyroid hormone to have less transference. So when compared to 45% of VO2 max, thyroid stimulating hormone went up 70-90%. So what they did was they started to get people's heart rates to go up. And as their heart rate went up, their T4 levels continued to rise, but their free T3 levels fell significantly. And what that means is the less active thyroid hormone is going to be acting on your tissues, including your heart. That's kind of a way your body countermeasures with thyroid, is that if you're overtraining and you make too much cortisol, it's going to keep you from making your heart rate and your metabolism over respond. And one of the big things that happens is as people get leakier and leakier guts, they tend to get more thyroid peroxidase antibodies. Their gut lining is broken down. Gluten sensitivity obviously been linked to elevated TPO, and LPS activation is linked to gluten sensitivity. So, LPS is basically the cell wall of bacteria that break down, and then the proteins from that cell wall end up circulating and causing problems with our immunity. Obviously, insulin, another big anabolic agent, it's needed to make branched chain amino acids go across to the muscle tissue. Obviously, keeping blood sugar under control is incredibly important for reducing inflammatory response in tissues, right? So insulin is really important in terms of being able to get it to function and not hyperfunction. Sleep deprivation can do it, right? So we're talking about this is what do you do for these folks? I mean, sleep deprivation is key. You can see that blood sugars go up, cortisol gets altered, even testosterone gets lowered as there's a heightened sleep deprivation that occurs. And this is something I try to get everybody to see, and I think Andy probably used it in his slides as well, Dr. Heyman. Your body doesn't care what the stress is, but the stressor hits the brain. The brain tells the spinal cord to increase sympathetic output. And the sympathetic output goes to the enteric nervous system. That's where it says ENS and the enterochromaffin cells. And it says make more peripheral corticotropin releasing hormone. Well, the problem with that is that it increases permeability of the gut. And we end up getting into these events where people have multiple food allergies. But this is a circuit that runs in all of us. And just becoming familiar with understanding all the downplay, not just structural, not just pain, but the breakdown in immune resiliency, the breakdown in adrenal function, they're significant. And of course, you know, when it's the brain, you're thinking of, well, it's about neuroexcitation, neurodegeneration, and structural plasticity, and balancing the immune system. Those are key things. One of the big problems that happen is that excitatory chemicals get to be released in the body, into the brain, and those neurons have to protect themselves by reducing their input surface area. So what happens is neurons, as your brain is decidedly excitotoxic, the neurons retract. And when they retract or get damaged, they have to be replaced. And this is the adult neurogenesis piece of understanding that it takes 2 to 4 weeks to create a new neuron. And, you know, there's a lot that can interrupt it. And one of the biggest things that can interrupt this is that stress hormones will bind to the progenitor cells and not allow them to progress. So they never get past here. It's really important that you understand that concept, that we have to correct the stress response, get rid of the neuroinflammation in order to rebud new neurons. And the longer you exercise, the more endotoxin you make, the more endotoxin you make, the more inflamed you make your brain. That's why you need to have your nutrition optimized, so you're not making excessive amounts of lipopolysaccharide. When LPS is upregulated, it can lead to more inflammatory cytokines, more oxidative stress. Super important and a great tool. And, you know, it makes up 75% of the material of the outer cell wall. So when a cell dies, it releases a lot of circulating endotoxin. And they showed that, you know, low levels of lipopolysaccharide, even low levels of lipopolysaccharide, can depress cardiac myocyte contractility. So your heart just doesn't contract as well. And I thought this was incredible when this came out of the European Journal of Heart, showing that chronic heart failure is a multi-organ disease. Decreased blood perfusion creates intestinal ischemia. So I can't get blood to my intestine. It alters the permeability of my intestine. I make more lipopolysaccharide. That triggers more cytokine release from muscle tissue and organs. And is what they felt and important to understand the gastrointestinal system and the pathogenesis of heart failure. That the gut may well be the lens to look at for cardiovascular problems. And this is, of course, a trigger immune cell called a microglial cell. And if you look to the right, it creates self-propelling neurotoxicity where the neuron gets damaged and gets eroded. And then once that neuron is damaged, you get more microglial cell activators by neurolaminin, alpha-synuclein, metalloproteinase 3, laminin. But these things start to create a self-fulfilling event where you trigger this, you create more glial activation, which triggers more neuronal excitotoxicity and death. So pretty significant. And you got to keep in mind, if people aren't training well and their mood's flat, you've got to work on their neurotransmitters. You know, work on their norepinephrine, their epinephrine, their dopamine, their serotonin, their PEA, right? Their GABA, whatever they need in order to match up with what their symptoms and moods are. Pretty much you're going to probably hit a home run every time if it just matches their symptoms. Obviously, these areas like the noradrenergic, dopaminergic, and serotonergic systems are important. Making sure that branched chain amino acids, I think, are fantastic for limiting the brain fatigue. I personally think it's really good. And then what are some labs I look at right away? Well, first of all, MEBs are really important. Monocytes, eosinophil, and basophil percents. you know, if it gets up over 10 or 11 when you add those three up, they probably have a fairly leaky gut that's a little bit reactive. I get a lot of people where they have way more than that number. And then you always can go on your clinical findings too. And then when you see more MEBs, that's where you have to worry about high lectin foods. So that means potentially beans, and what foods am I reacting to, so that you can really get a sense of where your chemistry is at. And this is just where it's at on a lab test. So what can you do about these things? Well, some interesting things. CoQ10, 50-kilometer runs versus placebo, looked at markers of inflammation, TNF-alpha, IL-6, 8-hydroxy-2-deoxyguanosine, or 8-OHDG. TNF-alpha levels went down with the CoQ10. Catalase levels went up, so we were sparing the liver and connective tissue. And creatine production in the muscle and muscle damage went down. That's exactly what you're looking about. This is great. And this is just kind of a pictorial of what happens to the labs post CoQ10. CoQ10 is huge for people that are training. And this is all the doses were before the particular study. 30 milligrams 2 days before with dinner, 30 milligrams 3 times a day before dinner from when she started, then 30 milligrams 1 hour before a run. It's not a lot of CoQ10, and it's getting pretty important results. And then zinc deficiencies are so common. As zinc gets low, your aromatase activity goes up. And if you're a woman, you'll androgenize, and if you're a man, you'll feminize. Right? You'll make more estrogens in that effect, and that's why you want to make sure you have adequate zinc. Probably another one that's incredibly important is magnesium. Magnesium, critical to some 400 plus reactions in your body, and probably the most critical of any for exercise recovery. So 10 milligrams per kilogram. And this was just a little study that we kind of threw together, and we've replicated this a few times because it's pretty interesting that you can give 10 milligrams per kilogram magnesium. You give some people training plus mag or just training, and it's amazing. Magnesium has such an impact on testosterone. It's just stunning. So mag, zinc, CoQ10, 3 big nutrients that are important for people to exercise. And in this study was interesting because it was 10 milligrams per kilogram of elemental magnesium too, by the way. So what I hope that you learned from this small time we had together is that you can train smart, and that means use protein powders to help your body to be able to get pre-digested nutrients across the gut lining. Think about probiotics. Think of the need for clearly zinc, mag, CoQ10, all of these agents that have been studied that can help you to perform at your best. So I want to thank you, and please train smart. Success in exercise occurs after you finish your training session, not while you're training. And I wish you that you have a great day. This is Jim LaValle, clinical pharmacist, board certified clinical nutritionist, wishing you the best.